I therefore wish to correct the suggestion from the European Council President that the UK has blocked vaccine exports. Let me be clear, we have not blocked the export of a single Covid-19 vaccine or vaccine components. This pandemic has put us all on the same side in the battle for global health. We oppose vaccine nationalism in all its forms. I trust that all sides of the House will join me in rejecting this suggestion and calling on all our partners to work together to tackle this pandemic. Mr. Speaker, this morning I had meetings with ministerial colleagues in others. In addition to my duties in this House, I shall have further such meetings later today.
Let's go to Daisy Cooper. Daisy.
Thank you, Mr. Speaker. The government is throwing a staggering £37 billion at a test and trace system that we know has made barely any difference, but yet it says that it cannot afford to give more than a pitiful 1% pay rise to NHS workers. The Prime Minister has said that he owes his life to them. He stood on the steps of Number 10 and applauded them. So will the Prime Minister do more than pay lip service and pay them the wage that they deserve?
Prime Minister.
Mr. Speaker, she is indeed right that we owe a huge amount to our nurses, an incalculable debt, and that's why I'm proud that we have delivered a 12.8% increase in the starting salary of nurses and are asking the Public Pay Review Body to look at increasing their pay exceptionally of all the professions in the public sector. And as for test and trace, Mr. Speaker, it is thanks to NHS Test and Trace that we're able to send kids back to school and begin cautiously and irreversibly to reopen our economy and restart our lives.
Let's go to Gagan Mahindra. Gagan.
Thank you, Mr. Speaker. I recently visited Long Marston, Bovingdon, Rickmansworth and Berkhamsted to see the damage that flooding caused to our communities firsthand. Can the Prime Minister assure this House that as the weather gets better, we do not lose the momentum of finding long-term sustainable solutions to prevent flooding in the future and to give residents the security they deserve all year round, irrespective of the weather outside?
Prime Minister.
I thank my honourable friend for what he's doing to campaign for his local area for flood defences. I want to thank the Environment Agency for their tireless and imaginative and creative work that they do to find solutions, and we're investing £5.2 billion to build 2,000 new flood defences over the next 6 years.
We now come to the Leader of the Opposition, Keir Starmer.
Who does the Prime Minister think deserves a pay rise more? An NHS nurse or Dominic Cummings?
Mr. Speaker, as I told the honourable lady for the Liberal Democrats earlier on, we owe a massive debt as a society, and I personally, to the nurses of our NHS. And that's why we've asked the Public Sector Pay Review Body exceptionally to look at their pay. I want to stress, however, as the House knows, that starting salaries for nurses have gone up by 12.8% over the last 3 years. And it is thanks to the package that this government has put in place that we now have 10,600 more nurses in our NHS, Mr. Speaker, than there were 1 year ago, and 60,000 more in training.
Starmer.
Mr. Speaker, he says nurses' pay has gone up. I know he's desperate to distance himself from the Conservatives' record over the last decade. As he well knows, since 2010, nurses' pay has fallen in real terms by more than £800. And he didn't answer my question. It was a very simple question. He's been talking about affordability. He could afford to give Dominic Cummings a 40% pay rise. He could afford that. Now he's asking NHS nurses to take a real-term pay cut. How on earth does he justify that?
Mr. Speaker, as I repeat the point that I have made, I believe that we all owe a massive debt to our nurses, indeed all our healthcare workers and our social care workers. And one of the things that they tell me when I go to hospitals, Mr. Speaker, as I know the right honourable gentleman does, is that in addition to pay, one of their top concerns is to have more colleagues on the wards to help them with the undoubted stress and strains of the pandemic, and that's why we provided another £5,000 in bursaries for nurses, another £3,000 to help them with particular costs of training and with childcare, Mr. Speaker. And it's because of that package that this year, I believe, we're seeing another 34% increase in applications for nurses. And we are on target. This government of this party of the NHS is on target to deliver 50,000 more nurses in our NHS, Mr. Speaker.
Mr. Speaker, he talks about recruitment. There are currently 40,000 nursing vacancies, 40,000 and 7,000 doctors' vacancies. How on earth does he think a pay cut is going to help solve that? And frankly, I'd take the Prime Minister a bit more seriously if he hadn't spent £2.6 million of taxpayers' money on a Downing Street TV studio or £200,000 on new wallpaper for his flat. Mr. Speaker, they say charity starts at home, but I think the Prime Minister's taking a bit too literally. Let me try something very simple. Does the Prime Minister accept that NHS staff will be hundreds of pounds worse off a year because of last week's budget?
No, Mr. Speaker, because, and of course we will look at what the independent peer review body has to say.